Great. Thank you, Stephanie. I'm glad everybody's here. I am going to go ahead and advance us through, just making sure I can use the slides.
There you go.
Great. Thank you. So first off, as Stephanie alluded to, what is pelvic rehab and what is this and why would I see a PT for anything about these things? And pelvic rehab is just this non-surgical approach that addresses what's going on in the pelvic region. And what do we consider the pelvic region? It's anywhere from thinking, you know, your belly region to your private area and then into the mid-thigh and so and anything in there PTs can treat. We address bowel and bladder function, sexual health, and any pain complaints. And what do we utilize? We end up educating our patients a lot about their bodies and what is normal or what is the new normal and what to expect. We might use some manual therapies, which means hands-on techniques to help somebody be aware of their body. And then also help somebody learn to strengthen their muscles, or we might have to teach somebody how to relax their muscles to allow them to have normal bowel and bladder function and sexual function. So there's a lot involved, and we have to dive in and see what we find, and we work together on that. Most pelvic rehab providers are physical therapy or occupational therapists. And that means we're really focused on the rehab side of things and what your muscles and your nerves and the soft tissues of your bodies are doing. But sometimes are nurses that can do this and sometimes naturopaths. But in general, if you're seeing somebody for a length of time, it's going to be some kind of a rehab professional. We take our time during our sessions to find out what you're most concerned about and what brings you in to see us. And there's definitely times where we see patients that they're not sure why they're coming in to see a pelvic rehab provider and what's it involve and why am I here? And we try to help you through that. And hopefully this little seminar here will help you along too, so you know what we can offer and how we can help you through your recovery and get back to everything you enjoy doing. Having trouble, can you advance the slide for me? Thank you. So the common conditions are continence, bowel and bladder function of the urgency and frequency of either bowel or bladder. We also treat constipation and any pain that may be involved also. And first, let's look at the anatomy. So the pelvic girdle, as we call it, which is the bony structure of the pelvis, it's made up of two bones, and if you can see my mouse here, so we have the ilium on this side, and we have a right and a left, and then we have the sacrum in between with the tailbone or the coccyx, and they come together at an area here called the symphysis pubis. And so this is the bony structure of the pelvis, and our muscles and our fascia and our nerves travel within this area also. And then the bigger culprit that we think about are the muscles, and how do the muscles work and how can you get better control of these muscles? So on this anatomy slide, on the side over here where you see my mouse, that's the male anatomy, or typically male anatomy, and then this is the female anatomy. When we look here, this is a model. This is a pen. I couldn't find one without the pen. Sorry for that. It's not some kind of a handle or anything. This is a pen, but this is the pelvis. And then this is a drawing of those muscles. The pelvic floor muscle anatomy, it's made up of 3 layers, and most of us, when we've read something online or we've gotten a handout from somebody or in some of our fitness classes, they often just talk about one layer of muscle, and that's the hammock muscle, also called the levator ani muscle. And that muscle strictly does this lifting contraction. It's actually the deepest layer of muscle. And on this drawing here of the male anatomy, it would be this muscle here. And on the female anatomy, it's here. It's rather deep. But what we really want to talk more about to make you aware of is that there's these superficial muscles that you're seeing on the model that I'm circling, as well as here on the male anatomy. These superficial layer of muscles, there's two layers, they're very close to the surface. If you look at your finger and you go from your fingertip to the very first knuckle, they'd be about that far in. So they're not very deep. Whereas that deeper layer that I was just talking about, the hammock layer or the levator ani, that one's more of the depth is usually about to your second knuckle. So this first layer of muscle, what it does is it closes and it seals the urethra, which is where we urinate out of. So we want to make sure that this first layer does its job on both the anatomy here. We want to make sure that this first layer seals and closes. It closes both the urethra and the anus. And so we want to make sure that that layer seals the openings to decrease our leakage. And then this deeper layer here that most of us have heard about, this deeper layer here and here, they really support our structures and they support our organs. All of these muscles are really important in that by getting them and learning how to close and lift our pelvic floor muscles, it increases our ability to have continence, so reduce leakage. It helps us make it to the bathroom longer, and it also helps support our trunk. And we'll talk about some of those things going forward. But just wanted to give you this orientation of the bony structures and the muscles that are giving us this nice support and helping us be continent and hold our urine, but also do our daily tasks that we like to do. So here's just a schematic, and here is a bladder. So these two pictures are of a bladder, and then this is a female urethra. The male urethra is longer, but for this picture, it's very similar to think of. Here is the urethra, and it's traveling through those muscles I just talked to you about. And the picture on your left side, where it's depicting weaker pelvic floor muscles and how that allows for leakage of urine, versus on the right side, we have more robust or thick muscles, and those muscles help give congruence or sealing off of the urethra so that then there is less leakage. So it's just a nice, easy depiction of why having good support is so important. Now, what are the functions of the pelvic floor? And a lot of people think of, oh, the pelvic floor it has to be nice and strong and tight, and it has to be shortened is another term for that. That may not be true, but in general, what we find is that folks contract or shorten the muscle to keep from leaking and to have sexual appreciation. The muscles need to lengthen or bulge or extend to be able to deliver babies, and then also for bowel movements. You have to be able to bulge a bit to allow bowel movements to happen. Pelvic floor muscles also rest, and all muscles rest. They don't walk around with constant tension. And so those muscles are always resting a bit to be ready for whatever we need them to do. And then they also maintain a little bit of tension to allow us to remain continent, but then also for support of our trunk and with movement. So we want to make sure that the pelvic floor does all of these things. And some folks think this is really fancy, and this is, oh, this is something very different from any other muscle of our body. But that's actually not true. If we think about our arm and our elbow, and we know we can flex our arm so that our elbow bends and our hands approximates our shoulder, and that would be contracting or shortening. We also know that we can extend our bicep or extend our arm, and the arm goes out fully lengthened and the elbow is completely straight, and that's that lengthening or bulge. But we usually walk around with our elbow slightly bent, and that's that rest or relaxation. So we know that our other muscles of our bodies do the same things. We're just describing this in a way that's very specific to the pelvic floor muscles. And then what happens, just to step back now, you get an idea of all these, like, oh, here's this great anatomy and here's what the muscles do. But what would happen if you walked in to see me? I would first ask you, what's going on? How are you feeling? What brings you in? Or do you know why your doctor sent you to me? And then you would share that. I would discuss with you what I just discussed with you about the anatomy and how things function. We're going to cover that even more as we go forward, but just that's where we would start in our session. And then I would talk to you about what kind of an assessment I need to do or I would like to do, and then you get to say whether that works for you or not. So it's very much a collaboration between us. We then go ahead and do the examination, and that includes looking to see in the private area, in your perineum, what your muscles are doing and what a pelvic floor muscle contraction means to you and how things move. We also probably would look at how your body moves in general to see if that's contributing to your symptoms. And then we would really specifically look at your pelvic floor muscles, like I said. That could include something called biofeedback, which uses small little surface sensors, usually surface sensors that we place externally but up close and personal on your pelvic floor muscle region. And then a graph comes up on a monitor that both you and I get to see. And we can see when you tighten, what does the muscle do? When you release, what does the muscle do? So you get to learn along with me what your body's doing, which is pretty great. We may need to do an internal exam. And that is something that helps us see how robust the muscle contraction is. Is it weaker on one side versus another, which I really can't assess when I'm just looking at your pelvic floor. So that's where the internal assessment may be really beneficial. But I definitely have patients who say, not this session. And that's okay. We get started on things, and then down the road, we reapproach it and decide if we want to do an internal exam if we need to, if things aren't improving or as you're more comfortable or something like that. So realizing that it's always us working together on what's best for you as an individual. After that initial session, we're going to come up with a plan, and we're going to talk through some of those options in the coming slides. We'll talk through a plan, what we think we can help with, what we would like to try. You can decide if that works for you, and then we communicate that with your team, your providers. We educate you on your bowel and bladder habits, your food and fluid. We discuss your home program. We may use some hands-on techniques to help with things, and then we work on self-care. And we're going to cover a lot of these topics in the next couple slides, so let's go into that.